Hey, everybody. So, hi, and hopefully you all are doing well. I am really attempting to kind of get myself together. Give me just a second. I need to change this so that everybody can see me, and then we will be good to go and ready to get in here. There's a lot to cover tonight, and I apologize. I am actually still downloading a very important video that I want you guys to see. So as I get that uploaded, let me just say welcome. As most of you all know, I am Dani Cook. If you are following me, then you know I am a bit of an online, hey Sherry, I'm a little bit of an independent online journalist, advocate, all things humanitarian matter to me. And I'm going to be reporting on a story that I broke last week. And going to bring you some additional details about that. This is really bothering me that it seems like my screen is a little blurry. So give me a second. Let me wipe this off. I think that's better, right? Is that better? I think that's better. So, I want to welcome you all. Hey, Jennifer Love, how are you? There are things that I'm going to be sharing tonight that I touched on last week. And the reason why I'm coming back around is because they are extremely important. Last week's broadcast was incredibly long, but it was necessary for me to tie a bunch of points together. And tonight, what I want to focus on is the care and the experience that Jeremiah Fields had when he was admitted to Holston Valley Medical Center's hospital in November of 2019. The reason why this is important is because Bristol Regional Medical Center, as you all found out last Friday, has recently also been downgraded to a level 3 trauma center. And, you know, it's important as we look back over the things that Ballad Health said to us about when our trauma centers were going to be changed and what standards were still going to be upheld and what things weren't going to change. And I want to take a look at Jeremiah's care specifically. I want to take a look at the report from the complaint that I filed where they did an investigation. And I think it's important for all of us to understand exactly what has transpired. So give me just a second. And I want to get this other piece uploaded. It may turn on as soon as I bring it on here. If it does, y'all just bear with me, and I'm gonna snatch it back down. See, I knew that it would. I knew that it would. And so I want to kind of dig deep and talk about these things. So let me grab the reports that I have and give you a little bit of information that I believe is really, really important for all of us. And for those of you all back home who are still relying on Ballad Health to give you the appropriate care for whatever healthcare situations you may find yourself in. And I'm not sure that all of that is happening. And what I do know for sure is that it didn't happen for Jeremiah, and that really does matter to me. Hey, what's up, bro? How are you? So I'm going to give it a second for you guys to share this video, to like it, to make sure that the people that you know and love and care about are watching. And then I'm going to dive right in. Okay, so let me also mention this. If you find yourself wanting to support my efforts and the things that I do, if you find yourself saying, hey, Dani, how can I assist, right? How can I help you continue to do the things that you do? You can do that through a myriad of ways, right? You can 100%. Hey, Brandy, how are you? You can buy some of my art, right? That is available. You can also, oh, that came in sideways. I hate that when that happens. Sometimes when I convert files to PDFs, they come in sideways. Hey, Mina. You can also go to my Etsy store, which is Intrinsic Connections, and buy yourself a Connect deck or some bracelets or any of those types of things. And you can support the talk show that we are putting together that will launch in 2022. If you go to thedaniCookShow.com, I believe I have a banner for that. You can 100% help make that talk show become a reality. Why do you want to do that? Because I care about issues that impact you and your families. I spend a lot of time researching and investigating things that have happened in healthcare and in other humanitarian and civil rights issues, and, you know, taking those things to a larger stage. Not that Facebook isn't large, but taking those things to a larger stage, a bigger platform to get them addressed is something that I'm very passionate about. Not for me, but because the greater the light that we can shine on these things, the more likely we are to get people to actually take action and do something about what's happening. So those are the ways that you can do that. Now, I want to ask for a second, if you could, by like just commenting or show of hands in the comments, how many of you all watched the broadcast last Thursday night and or have read the 2 articles that I put up on medium.com? How many of you all actually saw the broadcast last week and have a little bit of an idea about what we're going to talk about tonight? And yeah, Mitzi, I know you did. Jamie, you did. Jennifer, of course you did. Okay, cool. So we're going to be going into a little bit more in depth about the things that transpired. So first, let me just share with you all briefly what happened. Jody, you did great. So in November of 2019, you all know that we were still sitting outside of Holston Valley Medical Center, peacefully protesting the downgrade of both the trauma centers of Holston Valley and Bristol, as well as the neonatal intensive care unit that saved Bella's life, and we were giving it all we got. I want to remind you all, Samantha, you did, Sherry, you did as well. Great, perfect. I want to remind you all that during that time, we had online petitions going, we had paper petitions going, we were going to see the FTC, and I want to share with you throughout the course of tonight, I'm going to tell you about a complaint that I filed with the Tennessee Department of Health in February of 2020, in which I detailed to an investigator a story that Jeremiah Field's fiance, Jennifer, had told me when we were still outside of Holston Valley Medical Center. Matter of fact, she came down to the protest and shared those events with me as she experienced them in the hospital with him shortly after Jeremiah passed. And that story stuck with me because at that time, I saw pictures of not only Jeremiah's vehicle, but I saw pictures of Jeremiah in the hospital. I also, I'm trying to send something to myself, so bear with me. Not only did I see those things, but I listened to audio of Jeremiah. And I listened to him say, "God help me, I'm dying." And it stuck with me. And it stuck with me to such a degree that months later, I was compelled to share that information with someone from the Department of Health, the Tennessee Department of Health's licensure for healthcare facilities. Okay. And when you do that, they do an investigation. This is different than just complaining to the COPA board. This is different. This is a complaint to the licensure for healthcare facilities saying, "Hey, listen, we have concerns about the care that was given to this patient, and we think that maybe this patient did not receive the appropriate care." And so what they do is they have a medical professional who's now an investigator go out and do an investigation around the events that you've made a complaint about. And so when they did that, I ended up getting a letter. And the letter that I got was dated April the 16th of 2020. And the letter stated that the investigator had visited Holston Valley Medical Center March 3rd through the 10th, and that during that time, they had explored specific concerns. And that's literally what the letter says. The letter says, on March 3rd through the 10th, 2020, a surveyor of this office made an unexpected visit to Holston Valley Medical Center to investigate your complaint. The surveyor used the specific concerns you relate in your complaint to review compliance with regulations that most closely related to your concerns. The surveyor toured the building, watched staff working, talked with residents and employees, and reviewed records. The surveyor did find that rules and laws were violated at the time of our visit. The agency will take action since the surveyor determined the facility was not doing what they were required to do at the time of the inspection. Now, let me just say this. The only action that I'm aware of that was taken was that a CMS 2567, which is what's called a statement of deficiencies and plan for correction, was filed and sent to CMS, Centers for Medicare and Medicaid. There was no disciplinary action taken against the facility. There was no disciplinary action taken against the physician or any of the staff with regards to this complaint. And that's significant because there were laws that were broken as well as regulations. And I found all this out last week when I finally got a copy of the statement of deficiencies. It's a 25-page report. And so Jody, the only reason the investigation was done was because that's when I reported it. If I had never filed this complaint, there would have been no investigation. Okay, so when you're saying the investigation was done 4 months after the event, that's because I filed the complaint. I was calling because of the cardiac cluster deaths, and during that conversation with the Department of Healthcare licensure for healthcare facilities, there was a discussion that took place, and so I shared about more than one thing on that phone call, and the investigator. I didn't realize at the time that they were going to investigate every single thing I talked about. I literally was providing background and saying, hey, I know about this case, and I know about this case, and I know about this. And so when I got that letter back, I wasn't sure what it was actually pertaining to. So I called them to ask, well, what laws and what rules were violated? And I could not get an answer at the time. What I was told is that there's a process that they go through, and that once a statement of deficiencies was issued, then those things would become public. Well, as you all know, and I know, COVID happened. And so this kind of took a back seat. Life was all about, we were in a global pandemic, and, and I said at the time, I think that it was going to be very hard to do any healthcare accountability in the middle of a global pandemic. And so in August is when the whole Greg Neal incident happened. For those of you all who do not know what that is, that's where at another Ballad Health facility, the CEO of that hospital, who's now the former CEO of that hospital, participated in a cardiac surgery by taking a scalpel and making the initial incision into the chest of a patient. The things that are important for you all to take away from this, besides just the care that was given, that I think is very, very important, is that Ballad Health, neither in the Greg Neal situation nor in Jeremiah's situation did Ballad Health self-report. And that's important because they keep talking about how the process of their internal investigations are legally protected, and how important their internal investigation processes are, and how, it violates the trust whenever an employee whistleblower tells me or someone else about that process because they don't believe it's being done appropriately. And the reason why that's very, very important is because during this investigation, and I want you to keep in mind that this investigation happened just a week or 2 weeks after those cardiac cluster deaths occurred. And if you remember, there was a very public statement that Lindy White from Ballad Health put out about how sacred their internal investigation process is. There was this big, public statement about how they are required to self-report. Do you remember that? And here's what we know, they didn't self-report. And that sacred, very protected investigative process that they talked about, the thorough investigations that Ballad Health put out in that public statement and said that they always do, and they take the death of any patient so seriously, I question the validity of that statement, because in this document that I have, this 25-page report from the licensure for healthcare facility, in that the investigator says, the surveyor says, well, I reviewed undated plans of investigation, facility investigations, and an undated plan of correction. This is a copy of that exact thing. It says, review of an undated facility investigation. So this is my question. If Ballad Health does thorough investigations of every patient deaths, why is the investigation undated? When was this investigation done by Ballad Health of its own team members after Jeremiah's death? Was this done immediately after his death? Was this done after the surveyor arrived? When was this undated facility investigation done? Same thing for this undated plan of correction. When did those things take place? Because if they took place right after Jeremiah's death, that means that Ballad Health did not self-report for at least 4 months. Matter of fact, they didn't self-report at all because the only reason this investigator was there was because I filed a complaint. Right? Why does that matter to you? Because there are things that are significant about Jeremiah's care. So I want to explain to you that Jeremiah was in an accident. Daggone it. This also came in sideways. So give me 1 second. Right, Jennifer. So give me 1 second because I want to turn this around for you guys because this is important and I want you to see it. So give me 1 second. This is Jeremiah's car after his accident. The images that I'm showing to you tonight were provided to me by Jeremiah's fiance, Jennifer. Now, I want to correct some things. I just want to clarify some things because if you've been on social media, you've probably seen terminology about Jeremiah's wife, Jeremiah's fiance, Jeremiah's whatever. And, you know, Jeremiah was a human being. Quality control here. If you don't sign it and date it, it didn't happen. I got it, Jody. I got it. If you didn't sign it and date it, it didn't happen. So Jeremiah and Jennifer were human beings like the rest of us. Jeremiah had been separated from his wife for, I believe, around 15 years. Jennifer, correct me if I'm wrong. But they had never officially gotten divorced because divorces are expensive. Y'all know that. Even uncontested divorces are about $8,000 to $10,000, right? But Jeremiah and Jennifer had been together for about coming up on 4 years. The plan was in 2020 to use their tax return, get their divorce, and get married. They'd written their vows. They were raising children together. You know, they were, for all intents and purposes, a family. My heart goes out to Jen because, to be quite frank, because they weren't married and he was still legally married, she has no standing, even though she experienced every moment of his care at Holston Valley Medical Center with him. She watched him die. And so I'm happy that a lawsuit was filed because it was filed by his wife, which my hope is that all of his children that Jeremiah was raising, all of his children that he loved, no matter which woman they came from, my hope is that any financial gain that happens benefits all of the children. And so when I talk about his fiance, I've never met his wife. I don't know her. The person that I spoke with was Jennifer, his fiance. It was her mother who testified in at the local COPA hearing in January of 2020. It was her mom. I think it was January, maybe February 7th. It was one of the two. And so that's who I've talked to. So the images that I'm about to show you came to me from Jennifer. So Jeremiah was in this car accident. He was the driver of this vehicle, and he was ejected from the car through the windshield. This car rolled over multiple times and would definitively be called a level 1 trauma. This happened on November 9th, 2019 in the evening, sometime around 8:30 in the evening. Jeremiah was transported to Holston Valley Medical Center. I do not know why he was taken to Holston Valley Medical Center versus Johnson City Medical Center, since at that time, Holston Valley had been downgraded to a level 1 trauma center. I mean, a level 3 trauma center. And this was a level 1. So just to be clear about the levels, a level 1 trauma center is the highest trauma designation that you can have in the state of Tennessee. It says that you can provide optimal care. You have 28 specialties that are on call or on staff 24/7. 17 of those are surgical specialties. 11 of those are medical specialties. And that's what Holston Valley used to be prior to the COPA. A level 3 trauma center, those requirements changed dramatically. Those requirements dropped from 28 specialties down to only 4. Of those 4, 3 are surgical specialties, 1 is medical, and then the one that is a medical specialty is only internal medicine. Things that are not required as a level 3 that I do not know if they were present, I can only tell you that they were not required, is neurosurgery is not required, radiology is not required, orthopedics is not required, which that has a lot to do with traumas, right? So what we do know at that time is that Dr. Tiffany Lasky had left Holston Valley Medical Center. Right, Jody, I agree. We're going to be talking about personal details in just a minute. So what we do know is that Dr. Tiffany Lasky and Dr. John Keeley had left Holston Valley Medical Center because they believed that these changes to the trauma system would be detrimental to the public. There were concerns about the ability of Johnson City Medical Center to handle all of the traumas and what would happen not only to the people in Sullivan County, but also those in Southwest Virginia, because Southwest Virginia has no trauma center, and Holston Valley Medical Center was the closest level 1 for those individuals. So those 2 trauma surgeons had left, and Ballad Health had put in Eric Deaton, actually, in an article in the local news, had stated that they were using locum tenens from the University of Tennessee and to provide trauma care coverage at that time. I do not know if the locum tenens in question and that was involved in Jeremiah's care, I do not know if that individual came from UT. I only know that that's where Eric Deaton said that they were going to get them from. Let me see if I can grab that from you. I'm going to grab that for you. Give me just a second. Whew. It's an article that I had read, and let me just see if I've got this for you. Yep, I got it. So oh, and this was the other thing. Yeah, here we go. I'm going to put this in here. You all won't be able to see this comment if you're on my personal page, but it's an article from WJHL. I've put it in there. You'll see it on the other broadcast, but let me just give it to you what it says. It says, when asked why Ballad isn't waiting to downgrade Holston Valley services until after, because remember they were putting in the helipad at Johnson City Medical Center. They were doing some things to try to help Johnson City Medical Center handle this influx of trauma patients. And they were asking why Ballad wasn't waiting until those things were complete before downgrading Holston Valley services. And this is what the article says from WJHL. When asked why Ballad isn't waiting to downgrade Holston Valley services until after these upgrades are complete, Deaton said they wanted to make the transition before the state recertifies trauma levels on January 1st, 2020. Ballad said it is also imperative they stick to the October 2019 timeline due to recent staffing changes at Holston Valley. Deaton confirmed that 2 trauma surgeons, that's what I just told you, Lasky and Keeley, recently resigned after their contracts ended in June. He said one of them is staying on through September to help with the transition, and they are receiving additional support from surgeons at the University of Tennessee in Knoxville. He also went on to say, because there were some things that were said about general surgeons, like ER surgeons, being asked to or expected to take trauma patients. And this is what Eric Deaton said about that. And I'm quoting: "General surgeons are trained to take care of trauma patients as well. It's the way it's done in Bristol right now," said Deaton. "We're not going to force general surgeons to take any calls they're not comfortable taking." The question that brings up for me, is, when does this general surgeon decide they're not comfortable taking the call? When it comes in? Like, are we waiting until a trauma comes in at this time, right? To determine whether or not they're comfortable taking it? Like, when is that happening? It's just very concerning the way that all of this was done. So keep in mind, at the time of Jeremiah's accident, when he has had this multiple rollover motor vehicle crash, and he has been taken to a level 3 trauma center, where 2 of its longstanding trauma surgeons have resigned, and there's a temporary, what's called a locum tenens, a temporary trauma surgeon from somewhere else filling in. That's where he's at. And he's taken to this level 3 versus a level 1. Why? I do not know. Things that it would be interesting to know is, was Johnson City Medical Center, on diversion at the time? Were they taking him to be stabilized and then supposed to be transferred to the level 1 later? Those are questions that I don't have the answer to, that I think would be very useful to know. We don't know those things right now. So, and my understanding, Sherry, is that locum tenens surgeon was staying in Kingsport. Where in Kingsport, I don't know. It has been suggested to me that locum tenens, when they are in town, stay at the Meadowview. I don't know where that person was staying. Yeah, it was the closest trauma center to the wreck, Jody. But the question is, could his injuries could he have gone to the level 1, right? And I think it has to do, they've changed the destination guidelines since his accident happened. But I know that it has to do with closest trauma center or closest trauma center for the appropriate level of care. So Jennifer says, they told us in the ER when they were sewing his thumb up that they were going to transfer him to Johnson City, but it never happened. Got it. I remember you telling me that. So let me kind of continue sharing with you some observations that they made. So Jeremiah, in sharing his, you have to take certain things into consideration when you're providing care. Does a person's size matter? It does, only to the degree in terms of like recovery, treatment, medication, what is going to be required, right? So sometimes people's size does matter, right? Jeremiah was a big boy. He was like 6. What'd you tell me, Jen? 6'6" or 6'7" and 350 pounds, give or take. He was a nice size. He was a country boy, big boy, right? I think back in the day, back in his younger days, he used to play semi-pro football. But Jeremiah also was a recovering addict and was doing great. He was on prescription methadone at home under the supervision of a doctor. He was gainfully employed, hardworking guy, like I said, engaged to Jennifer, and a father, active in the lives of his children. And I said this in one of the articles that I wrote, that I feel compelled to always say those things, because the comments that I read in this report from the physician that took care of him, they make me angry. They frustrate me. They make me want to defend him as a person and as a human being. So there were 5 laws and violations, laws and regulations that were broken. And there they are. They are A-0084, A-0286, A-08385, A-0392, A-059. Those are the 5. that have to do with Jeremiah's care. The things that I will tell you is that, and here's their undated investigation, and it says this. So listen, there was a new graduate RN that was Jeremiah's nighttime nurse. And it says in this report that was hesitant to ask for assistance with no provider or residents in house. So, in other words, this was a new nurse who was hesitant to ask for assistance, and there was no physician in house in the medical ICU. The charge nurse that was supposed to be overseeing things had their own staffing assignment. They had a patient that they were assigned to. So that charge nurse's ability to oversee things in the unit was impacted because they had a staffing assignment of their own. The locum, the temporary, the contracted physician, it says in this report was not readily available. And then it says that the nurse did not ask the doctor to assess the patient in person, which I want to talk about that piece in just a second. And it says that the nurse failed to manually check the blood pressure, and that duplicate x-ray orders, 2 charts open at the same time, resulted in the radiology tech canceling one order, and the other order was also canceled. So let's talk about that one at a time. So first of all, in this medical ICU unit, what we have is a charge nurse that has an assignment of their own. You have Jeremiah's nurse as a new graduate trying to provide his care, working with a physician they're not familiar with. Like in one of the interviews, this nurse actually says, I've never worked with this physician. And if you know anything about nurses, right? Nurses who have worked in cohesive units. So units like trauma care, units like cardiology, even pediatrics, right? Even in the NICUs, nurses begin to know their doctors, and they know how those doctors think, how those doctors work, who needs to be asked to do this, who needs to be this, who needs to be that. That's what you get when you have a cohesive unit. When you have staff, whether they are locum tenens surgeons, whether they are travel nurses coming in and out, when you have staff coming in and out, just plugging holes, you lose that familiarity. You lose that cohesiveness as a unit that works together. And what you get is exactly what that report said. You get a nurse that's hesitant to ask because they got a physician they're not used to knowing, and their charge nurse has a patient assignment of their own. So you might ask, well, how does that impact Jeremiah? Well, one of the things that I found to be really astounding is I want to read to you Jeremiah's blood pressure levels from 12 a.m. to 5 a.m. Jeremiah coded at 5:30. At 12 a.m. being, so remember, his rec was on the 9th in the evening. The next morning, the trauma surgeon with a mid-level nurse practitioner rounded on Jeremiah that morning. So, you guys know about what time they do rounds in the morning, super early. And when that physician, they also issued an order at 5 o'clock that morning for an immediate stat, right? Follow-up chest x-ray. Now, there's something that's important about that chest x-ray. It didn't ever happen. According to this report, the new graduate nurse put in an order for this chest x-ray and accidentally, inadvertently, and by error, put in another order for a different patient by accident. So according to this report, the radiology technician had 2 screens up at the same time. That's what you read right here in this report when it says 2 charts were open at the same time. So what it says is that when that radiology technician canceled the order that was placed for one patient in error, it also canceled Jeremiah's order. So I want you to really take a second to hone in on this. You have a patient that's come in after this car wreck on a Saturday night. The next morning, you order a stat chest x-ray. That order is canceled by an x-ray tech. At 10 o'clock in the morning, the daytime nurse acknowledges receipt of that notification that the order has been canceled. The physician is not notified that the order was canceled, nor does the physician ever ask for the results of a stat chest x-ray. Keep in mind, Jeremiah's injuries, he had what's known as a flail chest, which is a life-threatening condition. So if I read it to you from the report, is that page 2, page 3? Hold on. It's easier for me sometimes if I just look it up on my thing. Hold on. Let me get to it, because when I'm on the computer, I can just like type in the search word. So a flail chest is defined as a life-threatening medical condition where a segment of the rib cage breaks and becomes detached from the rest of the chest wall. Okay. Jeremiah also had a traumatic hemothorax, which is an accumulation of blood between the chest wall and the lungs. Okay. That's what he had. So the initial chest x-ray was asked for by the locum tenens. He put in that order. Hold on a second. I have all the paperwork, but it's a lot to go through. Hold on. It's easier if I look it up this way than to dig through these papers for y'all. Give me one sec. I'm going to tell y'all. I'm looking up the word immediate. And the thing about it is like they were given what's called an immediate jeopardy, which is huge. Okay, here we go. So this accident happened on the 9th at 11:10. So the next morning at 5:45 a.m., there was a physician's order for a stat immediate portable chest x-ray. That's the one that was canceled. He did not ask, apparently, Jody, he didn't ask for the results because no one ever noticed it wasn't done. Now, I want to tell you this. Well, the nurse acknowledged it wasn't done. Let me just say that. The daytime nurse acknowledged that chest x-ray was never done. And what's important about this is that a chest x-ray was finally done on the morning of the 11th. Remember, it was ordered at 5:45 the morning of the 10th. One was actually done the morning of the 11th between 5:30 and 7:05 a.m. And you're going to say, well, Dani, how do you know that? Because that's how long Jeremiah's code was. Jeremiah's code was called at 5:32 a.m. His time of death was listed as 7:05 a.m. officially. And during the resuscitation process, they did a chest x-ray. And that chest x-ray that they did while trying to resuscitate him showed that Jeremiah's chest was, quote, full of blood. So let's be clear. At 5:45 in the morning, an order is done on the 10th for Jeremiah to have a chest x-ray. It is canceled by the radiology technician, right? The daytime nurse acknowledges receipt of that order being canceled. The physician does not ask, where are the results of this stat chest x-ray for my, critical patient with a flail chest? And when the night nurse comes in that night, he's not checking on it either. So at midnight on, technically at midnight, it becomes 11:11, right? So at midnight on 11:11, this is Jeremiah's blood pressure readings. Keep in mind that a normal blood pressure is 120/80. At 12 a.m., it was 139/78. At 1 a.m., it was 116 over 76. At 2 a.m., it was 104 over 77. At 2:15, it was 74 over 47. At 2:30, it was 76 over 50. At 4 a.m., it was 86 over 42. At 4:15, it was 73 over 29. At 4:30, it was 54 over 12. During this time, when the surveyor interviewed the night nurse, when the surveyor interviewed the nurse, he said, quote, he said that he reported to the physician on the phone, told him what was going on, that I am having a hard time getting his blood pressure. He, the physician, said, I am not really concerned with low blood pressure. He's been high all day. I also told him about the patient being anxious and having trouble breathing. The physician said, let's give him a milligram of Ativan and let me see if that helps. I get Ativan, and within minutes after I administer the Ativan, the patient's eyes dilated. I started CPR and called the code blue. I told someone to get him, the physician. He had to travel in. He did arrive during the code. We know the code was an hour and a half long. I don't know when he arrived. And then the nurse says, me being as new, I didn't know what else to request. In hindsight, I could have asked him to come see the patient. I didn't get a manual blood pressure. I don't believe it would have been accurate with him thriving all over the bed anyway. This nighttime nurse says that Jeremiah was sweating profusely, that he was thrashing all over the bed, that he was in severe pain. Now, I want to share with you something that the physician said to the surveyor. Keep in mind, the surveyor is the person doing the investigation based on my complaint. So, and this is 4 months after Jeremiah has passed. The physician actually says, and I quote, I'm just going to show it to you. How about that? This is what the locum tenens physician said to the surveyor, the investigator, when being asked about Jeremiah's care. This is what he said. If I had $1 for every narcotic abusing patient who complained of breathing issues after chest trauma, I would not work anymore. If I had $1 for every narcotic abusing patient who complained of breathing issues after chest trauma, I would not work anymore. Does this sound like a physician who is concerned about the health and well-being of his patient? Does it sound like this physician has a prejudice or bias because Jeremiah is on methadone under a prescription, under the care of a physician? Now, I want to remind you that the Tennessee Department of Health had this report in April of 2020. And I want to remind you that the Tennessee Department of Health took no disciplinary action against the facility, no disciplinary action was taken. I just need to let that sit with you all for a minute. I want to remind you that the Tennessee Department of Health is responsible, legally responsible, for the active supervision of Ballad Health and its COPA and its COPA requirements. I also want to remind you that Bristol Regional Medical Center's Trauma Center was just downgraded February 1st. It's also a 3 level now, a level 3. In 2019, when we were protesting and we were saying, don't do this, you're gonna impact the lives of our patients. Now, let me just say this. I am not a trauma surgeon. I am not a physician. I'm not an emergency room physician, right? So I cannot definitively tell you that the downgrading of Holston Valley Medical Center played a role in Jeremiah's death. What I will tell you is that I asked a physician who is very familiar with Holston Valley Medical Center's emergency room and trauma capabilities, both pre-merger and post-merger, both pre-downgrade and post-downgrade. And when I asked the question, do you believe the downgrading of Holston Valley Medical Center's trauma levels from a level 1 to a level 3 played a role in the circumstances and the care that was given to Jeremiah Fields and his subsequent death? And I'm quoting the response that I got. The response that I received was, yes, absolutely. Prior to that, there were always physicians in-house, attendings, residents in-house, ready to respond to the needs of patients. In 2019, WJHL interviewed Alan Levine asking about the downgrades to the trauma center and to the NICU. And I want to play a portion of that interview. It's very short, but it's a statement that I believe is very important, because this is what Alan Levine had to say when being asked about the decisions to make these downgrades by the board. So let me just share this with you.
There's no group of people more passionate about taking care of the people in this region, particularly our children, than our board of directors.
So listen, there's no people in the region more passionate about taking care than the board of directors. Not the doctors, not the nurses, right? Not the surgeons. No, you guys, you're not as passionate about taking care of people in the region than the board of directors.
There's no group of people more passionate about taking care of the people in this region, particularly our children, than our board of directors.
Now, I want to share with you a quote from one of those board of directors, because in September of 2019, Modern Healthcare did a 4-part series about the merger, about the downgrades, and about the protest. And in one of those articles, it was concerning the trauma downgrades. And in that article, they interviewed Oscar Guillemandego, who Dr. Oscar Guillemandego at that time was the chair of the American College of Surgeons Committee on Trauma for our region in Tennessee. They spoke with Dr. John Keeley, who was the trauma surgeon who resigned. And he said definitively, listen, I know of patients that would have died had we had to send them all the way to Johnson City Medical Center. Yeah, this is an issue, right? And they asked board director, Ballad Health board director, Julie Bennett, what she thought about people's concerns over the downgrading of Holston Valley's trauma center. And this is what she said. Whoops, wrong quote. Sorry. Wrong quote. I got to pull the right daggone slide up. I have too many in here for y'all. Here it is. This is what Julie Bennett had to say. Julie Bennett, a Ballad board member, said she thinks people's concerns aren't so much about quality of care, but how much longer it'll take to drive back and forth to get care. Quote, it's a convenience issue. It's not a care issue. But Alan Levine said there's nobody more passionate about the care of people. But Julie Bennett believes it's a convenience issue, not a care issue. I don't believe that Jennifer and Jeremiah's family would agree with her. I just do not believe that they would agree with her. Now, if you all think, oh, well, this happened in 2019, surely things have gotten better for our trauma centers. I shared with you last week that Holston Valley Medical Center and Bristol Regional Medical Center both had their trauma designations put under a provisional status to be reevaluated in a year. Since that happened, Bristol Regional has been downgraded from a level 2 trauma center that had 24 specialties down to a level 3, which is only required to have 4. I want to share with you video from the Tennessee Department of Health board, the Healthcare Facilities Board meeting from October the 5th of 2021. The gentleman that you hear speaking is Rob C. Schultz, who is over trauma at the Tennessee Department of Health, and he's giving his report. And he is addressing the provisional statuses for Bristol Regional and Holston Valley. Now, let me tell you, when I originally read the minutes to this report and I did not watch the video, I thought he also gave Johnson City Medical Center a provisional status, but he did not. And I corrected that on the post that I put up and said, I appreciate you all for being my second pair of eyes. So understand that Johnson City Medical Center, fine. The 2 Wellmont facilities, not so much. I want you to hear the condition of your level 3 trauma centers.
We'll be discussing.
Thank you. On June 21st, 2021, Bristol Regional Medical Center, which is a level 2 state designated trauma center, was site visited. They also have demonstrated an ongoing commitment to care for the injured patient with ongoing administrative support. However, 3 deficiencies were identified related to this particular visit. Number 1, there was no functioning surgical director or co-director for the intensive care unit. Number 2, the trauma program manager is not functionally 100% dedicated to the trauma program. And number 3, the PI program at Bristol Regional has not demonstrated the in-depth review and action-oriented programs to meet process improvement.
So I want to stop there. I want you all to hear what the deficiencies were again for Bristol Regional. This is last summer, and he's giving this report in October. I want you to listen to the deficiencies again.
100% dedicated unit. Number 2, there was a patient with ongoing administrative support.
Listen.
However, 3 deficiencies were identified related to this particular visit. Number 1, there was no functioning surgical director or co-director for the intensive care unit.
There was no functional director or co-director for the surgical intensive care unit in the trauma center.
Number 2, the trauma program manager is not functionally 100% dedicated to the trauma program.
So the trauma program manager has some other duties. The trauma program manager is not 100% dedicated to the trauma program.
And number 3, the PI program at Bristol Regional has not demonstrated the in-depth review and action-oriented programs to meet process improvement. And as a result, the site team recommends changing Bristol Regional Medical Center's level 2 designation status to provisional, with a focused follow-up site visit to occur in 1 year to ensure correction of identified deficiencies.
So this is last summer being reported this fall, and what? October, November, December, January. So 4 months later, Bristol Regional Medical Center was downgraded to a level 3. Now I want to get to Holston Valley Medical Center.
Recommends re-verification of Johnson City Medical Center here in the state of Tennessee.
All right, here we go.
Number 3, Holston Valley, which is the state designated level 3 trauma center, was site visited on June 23rd, 2021. Holston Valley Medical Center has also demonstrated a commitment to obtaining level 3 trauma center with ongoing state designation and includes administrative support. However, 3 deficiencies were identified related to this visit. Number 1, there was no documentation of surgical medical direction for the trauma patients in the ICU.
So wait, isn't that the same? I just need to, because remember the first one for Bristol Regional was there was no director, right? Or co-director for the ICU unit, right? So I just want to hear that again.
The trauma patients in the ICU. Number 1, there was no documentation of surgical medical direction for the trauma patients in the ICU. A surgeon is required to be director or co-director. Number 2, orthopedic.
So guys, listen to me. This baffles me because we are talking at this point 2 years, 2.5. Well, let me see. Jeremiah died November 11th, 2019. We are now talking June 2021. After they have gotten a 25-page statement of deficiencies about someone's care after a major trauma. And there's no surgeon that is the director or co-director for trauma care of patients in ICU.
Attendance at the trauma multidisciplinary committee is not at the required 50% threshold. And number 3, the current performance improvement process does not identify important process improvement issues, including complications, response times, audit filters, or measurable improvement outcomes for patient care.
So did y'all hear that? This is the same thing. Performance improvement. Nope, there's nothing documented for measurable outcomes and complications and all of that. No, it doesn't mean that Bristol did nothing to improve Mitzi. Bristol would have remained on a provisional status until June of 2022. But Ballad has been planning to downgrade Bristol since before the protest. And the thing that everyone should remember about this is that the downgrading of Bristol Regional Medical Center was not included in the COPA. It was not included in the COPA. The only thing included in the COPA with regard to trauma changes was the consolidation of level 1. That's it. The consolidation of a level 1 trauma center was the only thing approved in the COPA upon closure when it comes to trauma. And that doesn't even mean, yes, so they say, oh, well, the downgrade of Holston Valley was approved in the COPA. Technically, but not actually, right? Because what was actually approved, technically approved, was the consolidation of level 1 trauma status, trauma services. So they could have downgraded Johnson City Medical Center, not Holston Valley Medical Center, because the COPA didn't say, yes, downgrade Holston Valley. It said, yes, you can consolidate level 1 trauma centers. The COPA did not say you could downgrade Bristol Regional Medical Center. What it does say is that if you're going to make a change, a material component or a key component of a trauma service or a major service line, which trauma is a service line, it's supposed to go through a 90-day approval process, which Bristol Regional did not. Bristol Regional did not go through that process. Now, Ballad might argue and say, well, listen, we don't think going from a level 2 to a level 3 is a major component or a key component. And material component and key component is not defined in the COPA, right? So the question becomes, can you actively supervise a COPA that is not adequately defined? Can the Tennessee Department of Health if they wanted to, and I am not convinced that they do, but if they wanted to, can they actually actively supervise a COPA that is so ambiguously written? So I wanted to share with you all a little bit more in depth because last week I had to connect a lot of dots and I needed to circle back around to talk about Jeremiah one more time because I feel like it's incredibly important for us to remember that this gentleman was in a car wreck that rolled over multiple times, that he was ejected from the vehicle. Yes. Was he prescribed methadone by a physician? Absolutely. And he was doing well. He was raising a family. He was engaged. He was working hard, right? Doing construction contracting work, gainfully employed, planning to get married, right? Working to get some money so that he could finalize his divorce, right? This is where he was in life. He was in this accident and was taken to a level 3 trauma center. He had an x-ray that was never completed, at least not before he was already coding and dying. No, it's the consolidation of level 1 trauma centers. No, it specifically says in the COPA that it's the consolidation of level 1 trauma centers because they had 2. So the idea was to reduce the duplicate services. So what they could have also kept Holston Valley as a level 2 if they wanted to, but that wouldn't have saved enough money. Because like a level 1 to a level 2, one has 28 requirements, the other one has 24. But a level 3 only has 4 requirements, folks. I don't know what else to say. I've been over this statement of deficiencies multiple times now. And every time I read it, like, I've never held one of these in my hands until a week ago. And what I realized is that the report is broken up. So like these first few pages, I say few, but these first 7.5 pages are all the first deficiency. The next 1, 2, 3, the next 3.5 pages are the second deficiency. The next 1, 2, 3, 4, 5. The next 5.5 pages are the next deficiency. 1, 2, 3, 4, 5, 6.5. So the next 7 pages are the next deficiency. And the last 2 pages are the last deficiency. 25 pages. And what really bothers me is that they took no disciplinary action. And here's the thing, y'all. Like the surveyor saw that they had undated facility investigations and undated plan of corrections, right? They could have taken action against the facility for these things, for all of these laws and rules that were broken, but they didn't. And I started to think about that. I started to think about, well, why didn't the Tennessee Department of Health or the Centers for Medicaid and Medicare, why didn't either of those 2 organizations penalize Ballad Health? Why didn't they put together some financial penalties? And then I thought about this. I thought about this very fact. The COPA states that Ballad Health is required to reimburse the Department of Health for the cost of actively supervising it. So in other words, whatever money that the Tennessee Department of Health is spending to supervise the COPA, Ballad is required to pay that money back. So does it help the Department of Health if they fine Ballad money? Or are they hurting the organization that is supposed to be paying them back? The other thing that I thought about this is that Centers for Medicaid and Medicare, when I talked to them, they said, yeah, we do terminate providers sometimes, but it's very rare that we would ever terminate an entire healthcare system or hospital. And I started to think about this. 70% of Ballad Health's customer base are people on Medicare or Medicaid. So if CMS were to ever terminate Ballad Health and say, no, we're not ever reimbursing you again, it would leave hundreds of thousands of people in the region with no insurance coverage to the only healthcare system that owns all the hospitals in the region. So it makes it damn near impossible for CMS to terminate Ballad. So that brings me to this final question as we wrap up. If the Tennessee Department of Health would be hurting Ballad financially, and Ballad is supposed to reimburse them for their expenditures of the COPA, can they are they going to actively supervise and penalize? And if CMS can't terminate them because the majority of the region needs CMS to get medical care, right? Can Ballad Health actually be supervised? Can Ballad Health be actively supervised like the law requires? And if they cannot be actively supervised, do they still qualify for immunity? Because if they cannot be actively supervised and are not being actively supervised, then maybe they don't qualify for active supervision. Maybe that old COPA law isn't going to protect them after all. Jen, I'm going to get through this broadcast tonight without crying. You and I have chatted quite a bit. You are welcome. I hope that Jeremiah's children get some sort of benefit from these findings. I hope that someone is finally held accountable for what happened to Jeremiah. I hope that this physician, whomever it is held accountable. I hope that Ballad Health is held accountable. Because by their own admission, let me just tell y'all this before we go. When I read, this is from the chief medical officer at Holston Valley Medical Center during a telephone interview with the surveyor on March the 4th, 2020 at 4:54 p.m. The chief medical officer stated, and I'm quoting, ... X-ray was done during the resuscitation and he, patient number 1, which is Jeremiah, had a chest full of blood, ... Opportunities were missed along the way, ... Leader of the team, which is the physician number 1, not following essential standards of practice, ... We pointed that out to this locum, ... Would have been a chance to mitigate the pulmonary condition, ... Maybe not, ... Quality impact on the patient, ... He, the physician, disagreed, ... We left it as a validated concern, ... That locum is no longer here with us. What happens if the COPA isn't covering? I'm not sure what you're asking, Samantha. If you're asking me what happens if the COPA isn't actively supervised, or if they don't get immunity anymore, what does that mean? What it means is if at some point it is determined that the Tennessee Department of Health either isn't actively supervising or cannot actively supervise, then that means there's no state action immunity. That means Ballad Health does not get antitrust immunity because of the COPA, because they're working with the state. They don't get that anymore. And if they don't get that, that means the FTC could potentially come in and say, you know what? You're not going to have a medical monopoly anymore. The FTC could come in and do a lot of different things. Now, do I know that they will do that? No. I am simply saying these are the questions that I have. Yeah. I think that's why this statement of deficiencies is so important. Because I will tell you this too, just so you all know. Y'all remember Lindy White telling everybody how important their investigations are. If you remember, she said they are required to self-report. She said all of those things in a public statement, February 23rd of 2020. And I will tell you what this interview says. It says, during an interview on 3/10/2020 at 1 p.m., the chief executive officer, CEO, stated there was not a written plan for the implementation excluding ICU charge nurses from staffing. And the facility was not monitoring how often the charge nurses were assigned patient care. The CEO was unable to show documentation for monitoring the effectiveness of the facility's plan of correction. She flat out said, Lindy, y'all aren't doing anything that you said you were doing. Well, Mitzi, let me just say this. He can't make another bill that supersedes that. It doesn't happen. Okay, so that's number one. Number two, my hope is that you all vote Rusty's ass out of office. Kate Craig is running for his seat, and it would be in the public's best interest to elect her because she isn't on Ballad's payroll. Rusty is. There is not a definition. There is no case law that defines active supervision at this point, Jody. There is no case law that defines active supervision. So that's what it would take. And let me just say this. I believe that at some point in time, there's going to have to be a case law around active supervision because more and more mergers and more COPAs are attempting things. No, that's not a loophole for Ballad at all, Samantha. That's not a loophole. That's something, it just means that that's what a court would decide. That's all it means. That's not a loophole. That's not a loophole. When I say there's no case law, what that means is that's what a judge would do. A judge would determine that. That's what I mean. A judge would determine that. So that's what we need to be focused on. You know, I think we spent a long time talking about is Ballad violating the COPA. And for us, we read lots of things where it just made sense to believe that they were. And the Department of Health was simply saying, no, it doesn't exactly say that. No, it doesn't exactly say that. No, and so my question is, well, what does it say? Is the COPA even written in a way that violating it can be determined? And if it is not written in a way that violations can be determined, then active supervision is impossible. And if active supervision is impossible, then you boys don't get immunity anymore. And maybe, just maybe, things change. And maybe it took a lot longer, and maybe people died in the process, and, you know, but we are still here. Some of us are still here. And so I think that that's what's important. There has to become a definition of active supervision, a legal definition at some point, because if not, rural communities all across this country are going to be subject to COPA laws like this, COPAs like this, and experiences like this. It will be exploited if we don't have case law at some point. So we have to do that. We have to keep digging. We have to keep pushing. We have to keep reporting. We have to keep speaking truth, even if our voice shakes. And we have to vote politicians out of office that shouldn't be there. People who are putting through legislation, when they are on the payroll of companies. It's time to get rid of those folks. It's time to put people back in politics. It's time to put public service back in politics. And it's time to put humanity back in healthcare. Okay. That's it. That's what I wanted to share with you all tonight. Hopefully I got it all. If you have not read both the articles that are on medium.com, do so. They're very detailed. They have links to everything so that you can check them out. Be your own advocate. Be advocates for your loved ones when they are in the hospitals. And like I said before, if you want to support me, buy some of my art. Go to my Etsy store, do some of that stuff. And then you can also support the talk show that we're putting together. Can you all imagine a broadcast like this with me sitting on a stage with medical professionals and whistleblowers being able to discuss these things? And then you guys could go on, I don't know, maybe cable TV, but definitely streaming services and be able to watch it. Can you imagine if thousands upon thousands of people became aware of what you and I know? Thanks, Sabrina. Yeah, I'm getting ready to mail this one out to Mandy. That's just a little bit of my art, y'all. But can you all imagine? That is why go to thedanicookshow.com. Donate, become a sponsor. Like I said, buy some of my art. Contrary to what some people say, I'm not a paid protester. You will get to hear that next week, Jody. So I ended up getting some additional information about Ballad's financials, and it was a lot of information, and I started going through it. Yeah, Jennifer, that one's still available. I still have that one. But I started going through it, and I need to, it came from a new source. And while I trust this source, it's a new source of information. And so I need to go through all of that information for myself firsthand. I need to dig a little bit deeper and then come back and give it all to you. So that will be next week that you hear about Ballad's COVID money. And there's also some other financial things that you'll learn about Ballad next week. So that's it. That's all I got. I appreciate you all. I'm going to go take care of these grands and try to get a little rest. It's been a lot. So Jen, sending you guys lots of love, hoping that I'm representing Jeremiah and his experience well, and that some form of justice comes and that his children benefit from that. All of them. So, all right. I do. Jody, I need a whole team. I need a whole team. Yeah, I need an assistant and a whole team. Let me just tell you, if I had a whole team, I would have one group of people that would be investigating the bonds that were issued for the refinancing of Ballad Health's debt. That would be one team. I would have another team that would be investigating their real estate company and their for-profit companies, along with their nonprofit companies and their tax-exempt status with the IRS. I would have another team that would be reviewing the merger research and sharing of things that took place prior to the law passing and immunity being established. I would have a team looking into that. I would have a team that would be looking into the regionalism efforts and the individuals that are on those boards and on those committees. I would be looking into that. I have a lot of things that if there were more of me or a team, for example, a research team that comes with a talk show, we'd be digging into all of that. That's what we'd be doing. So I appreciate you all very much. We're still working, and I still believe that doing this work is in the best interest of the public, and necessary trouble, good trouble, and sometimes scary trouble. But got to do it. All right, I'm out of here, you guys. Be amazing, be like, be love. Peace. Y'all, let's get me a talk show. Y'all come on down, I'll hire you. Bye.